hear this word, you probably think of crime thrillers and sinister characters like Hannibal Lecter or Norman Bates. This isn't really surprising, as when most people think of psychopaths, they think of sadistic, evil people who do awful things with little rhyme or reason behind them. And to be honest, it wouldn't be hard to find an article about some awful crimes that have been committed by someone who has been labeled a psychopath. But this doesn't really give you the full picture. For starters, psychopaths who are criminals, often the crimes they commit are almost always premeditated. They are highly organized individuals, and there is always a reason, a logic behind the things that they do. But the main focus of my topic today is that I believe that psychopaths aren't necessarily bad. In fact, I believe that overall, they actually benefit society. But first of all, please could you raise your hand if you would like to become, or you have a parent who works as a surgeon? Okay, thank you. Now, please could you raise your hand if you have a parent who works in a senior level in business? All right, cool. Well, a fun fact, especially for those people, is that these are two professions that are actually extremely well suited to the typical personality of a psychopath. So as you listen to this talk, you might start to wonder about others, your parents, maybe even yourself. But before you start hyperanalyzing, just know that according to psychologist Robert Hare, only an estimated 1% of society could actually be considered a psychopath. Unfortunately, there is little research into psychopathy, and the research out there is almost entirely focused on criminal psychopaths. This is actually rather showing by the statistic that I just gave you, because when psychologists say 1%, typically this actually means we recognize that these types of people exist, but we don't actually know how many of them there are. This is because psychopathy is no longer an official diagnosis, as it isn't recognized in the most recent Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, which was a manual collated by the American Psychiatric Association designed to help healthcare professionals diagnose their patients. Psychopathy was actually included in earlier editions of the DSM before it was replaced with antisocial personality disorder. This is because any research into psychopathy tends to be underfunded and people undertreated. This is partially due to issues in giving accurate evaluations. For example, how would you evaluate a person's levels of empathy? But also due to disagreements in how to fundamentally define what psychopathy is. Some people were also concerned that the label of psychopath had too much negative stigma attached to it and could lead to harmful outcomes if it was used for diagnosis. Despite psychopathy no longer being an official diagnosis, there is still the Psychopathy Checklist Revised, which was created by the aforementioned Robert Hare. It's basically a list of the common characteristics of a psychopath, designed to identify them. Essentially, I have boiled it down to psychopathy is typically characterized by a lack of empathy, antisocial behavior, and superficial charm. Unfortunately, the last time the Psychopathy Checklist Revised was actually updated was in 2003, which I think is really representative of the lack of research into psychopathy. And due to this lack of research, we are unable to confidently say how many people in society could be identified as a psychopath, as the only place where you can really be diagnosed is in a prison, normally for legal reasons like terminating sentences. Hence the focus, and I suspect, overrepresentation of criminal psychopaths, which definitely adds to the negative stigma. Therefore, I think that it's quite likely that there are going to be more psychopaths in society than we suspect. Many of them are going to be well respected and well integrated in their communities with good jobs. These people could be identified as prosocial psychopaths, as coined by James Fallon, a neuroscientist and self-identified prosocial psychopath. It's widely accepted that psychopathy is caused by a mix of both environmental and genetic factors, with the emphasis of one over the other frequently debated over. Sociologists will tend to focus on environmental factors, whilst psychologists and psychiatrists will tend to focus on cognitive and genetic factors. Most psychopaths will be genetically predisposed to psychopathic behaviors, and then these will either be reduced or exacerbated by the environment that they live in. For example, The NHS states that traumatic or negative events during childhood, such as abuse or neglect, can be instrumental in developing psychopathy. And parenting that is not warm or responsive will also have an effect in developing psychopathy, particularly during childhood, as this will affect their early emotional development. The prosocial psychopath emphasizes the importance of both environment and genetics, because obviously prosocial psychopaths have psychopathic characteristics, but normally they have no criminal or violent ones. This is because prosocial psychopaths will be genetically predisposed to psychopathy, but then due to a positive environment during their childhood, will have reduced antisocial behaviors. A psychopath's brain functions differently to that of a typical person. And one region of the brain that I think displays these differences really nicely is the prefrontal cortex. Psychopaths will have an imbalanced prefrontal cortex, with an overactive upper or dorsal prefrontal cortex and an underactive lower or ventral prefrontal cortex. These regions allow us to effectively connect and communicate with other people. So due to this imbalance, psychopaths will have a lack of empathy, but they will also have the ability to accurately understand what a person might be thinking and then respond appropriately. Expert research in the field, such as findings from neuropsychiatrist Dr. Octavio Choi, said that psychopaths know the words, but not the music. However, it is believed that due to their upbringing, prosocial psychopaths have actually been implicitly taught to use these psychopathic traits in a way that benefits society as a whole, hence prosocial. But basically, to keep things from becoming too complicated, due to the imbalance in their prefrontal cortex, psychopaths will be hyper-rational and have the ability to stay calm under pressure. And due to their lack of empathy, they will be able to objectively assess situations and make difficult decisions that most people would probably be too uncertain or too afraid to make. Because, to be honest, psychopaths are just less concerned about people's feelings. Funnily enough, these characteristics actually can make them successful leaders, business people, doctors or surgeons, or military personnel. All of which I would say are pretty widely well regarded in society. And whilst not necessarily nice people, psychopaths have the confidence, charisma, and decisiveness to work in these tough roles that arguably require a certain level of callousness to be good at. For example, you would want a surgeon who is nonplussed about cutting someone open. You would want someone completely confident in their ability to get the job done. Hare reports that many people in senior levels of business could be identified as psychopaths, and some, such as journalist John Ronson, the original Louis Theroux, if you will, based on an interview with a seemingly ruthless business executive, suggested that capitalism at its core actually allows for psychopaths to thrive. And as well as these professions being befitting to the typical personality of a psychopath, there are also qualities to them that would be attractive to one. For example, many of the jobs that I just mentioned are well paid and well respected. But most notably, they give an element of control, even power over other people, an obvious example being military personnel. While most psychopaths won't choose these jobs for morally or socially acceptable reasons, for example, wanting to become a surgeon to help people in need, this definitely does not mean that they would not excel at them. Psychopaths are more than happy to fall in with everyone else and follow the rules, so long as it benefits them. Unfortunately, this means that they are more than willing to step on other people if it means that they'll get what they want. For me, this all raises the question of, is there even a need to treat psychopathy? And are some treatments even ethical? There is no cure for psychopathy, but there are ways to reduce certain behaviors through things like medications, such as mood stabilizers. Cognitive behavioral therapy has actually been shown to help children displaying psychopathic characteristics. But therapy for criminal psychopaths has actually been shown to worsen them. This is because it reportedly taught them how to better manipulate people, because they didn't actually feel that they needed to change their behavior. There are also newer, more theoretical treatments, for example, gene therapy, which would basically remove the mutated genes linked to causing psychopathic characteristics, therefore eradicating them. However, this could cause a whole host of unknown knock-on effects, and would also just be really expensive. Furthermore, I think it's important to note that to say that psychopathy is caused by a collection of genes or their mutations is just too simplistic. Another potential method of treatment could be transcranial magnetic stimulation, or TMS, which basically works by modifying the way the brain functions by changing its electrical environment, because obviously the brain functions through electrical signals. Basically, a magnet coil is placed on the scalp, and it will generate specific magnetic pulses which will either stimulate or inhibit specific regions of the brain. This isn't yet a perfect system. However, it does mean that in theory, certain regions of the brain, for example, the lower or ventral prefrontal cortex, could be stimulated. This would increase empathy and therefore reduce harmful manipulative behavior. But in my opinion, these sorts of treatments should only be considered in extreme cases where not having them could potentially be dangerous. Whilst there are clearly issues associated with psychopathic behaviors, there are also undeniably benefits. And to eradicate these traits through things like medication or TMS doesn't seem to be the best idea. Obviously, things must be done to protect people from dangerous psychopaths, but to eradicate them or dehumanize them is just not going to help the issue. I think that it's important to understand the differences between people in order to be able to cater for everyone's needs, which should be the reason why these kinds of labels are used. The label of psychopath has so much negative stigma attached to it, which isn't surprising because it's pretty much only spoken about in a negative context, even though, as with many things, psychopathy is a spectrum, and obviously people are just complicated. So hopefully today, you have realized that psychopathy is a fascinating and hotly debated subject that I think we need to know more about. And hopefully, you can see where I'm coming from when I say that psychopaths are actually beneficial to society.